Welcome back to the Delaware Way. I'm Larry Menti. An initiative to make certain that people know what their blood pressure is and the problems that could result in not knowing. For that, we talked to Christiana Care blood experts, blood pressure ambassador Chantel Crieke, and project manager Angela Parker. Thank you so much for both being here. What is the initiative exactly? I know you've been doing this for 8 years.
Yes, so the Blood Pressure Ambassadors is a program at Christiana Care Health System. It's out of the Center for Heart and Vascular Health. And what we do is we go out into the community and we screen for high blood pressure, and we also educate about the consequences of untreated high blood pressure. So we want the community members to know that if their blood pressure is not managed correctly, that they are at risk for stroke, heart disease, and kidney disease. The program has been in existence since 2011, and the original program used Christiana nurses and community nurses. Our new program started in July of 2015, and we recruit lay people within the communities of the city of Wilmington to do blood pressure screening and education.
Oh, just to make sure that more people have blood pressure checks. The thing is,
Yes.
Chantel, every time I go to the doctor, every time I go to an emergency room, they check my blood pressure. It's one of the first things they do. It's hard to believe that there are people out there that don't get their blood pressure checked regularly. Where is the hole in that safety net?
Well, the significant hole is there are many folks who don't go to the doctor. You know, for those of us that may go on a regular basis, that's our perception of, oh yeah, I have it checked regularly. But there are many individuals who don't go to their physicians on a regular basis. And until very recently, there are a lot of folks who didn't even have health insurance to be able to understand what their numbers are and have a regular relationship with their physician. And that's why, as a community blood pressure ambassador, it enables me to engage with the everyday person from my everyday perspective on what those numbers mean, and to connect them with a physician if they don't have one, with insurance resources if they don't have insurance, and just to remind and encourage them that regular checkups are really essential to long-term health.
And Chantel is exactly what you were talking about a moment ago in having more people in the community do these checkups.
Yes, because we provide free training and free equipment to those people who want to be volunteers in the Blood Pressure Ambassador program. And the people that we recruit are either residents in the community, or they work in the community, or they attend places of worship or churches in that community, and they build a relationship with the people that they are doing blood pressure screening.
And you've been doing this for years now. Do you have empirical evidence? Do you have examples of this working?
Well, since 2015 in July, we've screened over 3,000 people, and we still have more people to reach. And the people that we screened when we ran the data, over 50% of those people were hypertensive. And that means either they didn't know they had high blood pressure at the time of screening, or they did have high blood pressure at the time of screening and they are not managing it correctly.
I guess I'm looking for a personal example, and I know you can't give names because of HIPAA, but in general, are there people that you have found that weren't getting checked, and thank God you found them in time?
Yes, we have personal examples of community members. We can't give names, but there have been community members that have come to us and been screened several times. And initially, they felt they didn't have high blood pressure. But after they came back and was screened again, they see that the number wasn't moving. So then they were able to go to their doctor and get help for high blood pressure. In addition to that, we do have some ambassadors who, after becoming ambassadors, because they had their own equipment at home, they were able to screen themselves and found out that they too had high blood pressure. You can go to the Christiana Care Health System website, and if you type in the search BP Ambassadors, you will come to the Blood Pressure Ambassador website.
Thank you so much. I appreciate you both being in there, and keep up the good work.
You're
Christiana
welcome.
Care blood pressure experts, blood pressure ambassador Chantel Crieke, and project manager Angela Parker. That wraps up the Delaware Way for this week. I'm Larry Menti. Another Thing is next.